Our vision is to expand our clinics for access to care.
Our vision is creating training opportunities for healthier communities.
Our vision is to build a healthier future for our people.
Our vision
is that Alaska Native people
are the healthiest people.
The healthiest people in the world.
The healthiest people in the world.
Sanitation, in many ways, helps to keep people from coming to the doctor in the first place.
Through the public health lens, we are looking at innovative ways to approach sanitation solutions in our communities that have been unserved in the past.
ANTHC showed a strong commitment to addressing one of the more difficult problems that the state has been looking at now for over 40 years. What do you do with the honey bucket? The PASS system was one of the first real attempts to address sanitation within the home.
PASS stands for Portable Alternative Sanitation System. It is an in-home system that provides potable water and a drying toilet to help eliminate the wash basin and a honey bucket from communities that don't have piped infrastructure. Our mission is to create space within those communities to be the healthiest people in the world. And in order to achieve that, we have to provide them with access to safe drinking water and adequate sanitation. And PASS is bridging that gap.
Nobody wants to be in the emergency department. Nobody wants to be sick. But if you can see people quickly, safely, and compassionately, they feel better and feel like they've gotten good health care. Over the past year and a half, we've taken many measures in order to decrease the amount of time a patient spent in the waiting room. We actually had to change our physical space, and we made 2 triage rooms plus another treatment room where we can do EKGs. So the first thing that a patient sees when they walk into the emergency department is a nurse. We've also remodeled some of our space to have more beds to see more patients. We're working every day to improve not only the emergency department, but what happens after a patient is admitted to the hospital. There's a lot of things that are happening within our department and across the hospital to improve that time that the person spends in the ED. It's not just when they come into the emergency department, but it's throughout their whole stay.
Patient experience is critical to a hospital system. I get an opportunity to hear from the patients and the family members we serve. Whether it's good or bad, this provides me an opportunity to work with the rest of our hospital team to improve upon the patient experience for the 176,000 people we serve. We get a lot of feedback about the on-site amenities at patient housing. Our housing guests really appreciate having access to the traditional native foods and the patient housing cafeteria. We also get compliments related to our employees, the friendliness, being kind, courteous, respectful. Patient experience is more than just the customer service. It's about our organizational culture, about the individual perceptions of the people we serve, about the continuum of care, and about each interaction that a patient has. This all makes up the overall patient experience.
The health of our communities includes mental and behavioral health. It affects the individual. That individual's behavioral health problems might affect their relationships and their family and their community overall. So it's critical that we, as a community, are addressing these issues. BHA training and the services they provide offer a beautiful blend of Alaska Native culture, traditional knowledge, and clinical best practices. ANTHC works regularly with our tribal health organizations to make sure that our training program is informed by and helps to prepare BHAs to provide services that are unique to their community. Over the years, we have been able to establish more partnerships that have allowed us to really take the BHA curriculum and develop it into different training models that make it more achievable for BHAs to get their certification. These pathways and these partnerships that we have with other folks like Ilisagvik and the Alaska Pacific University really allow BHAs to advance in their careers also. Behavioral health aides are compassionate, they are informed. They really know their communities. They're really familiar with their community members and the issues that they face. Many of them have their own life story that has led them into this position, and so they're able to connect with people in a way that is just, it's heartfelt, but it also helps to drive them to make the changes that they would like to see and experience long term.
The Community Health Aid Program was originally created to address underserved areas of Alaska and increase access to care. They are still the front lines of providing care in the villages and vital to the health of Alaska Native people. There's about 550 CHAPs. They are in 180 villages and serve 62,000 Alaska Native people. The Community Health Aid Program was initially started in the 1950s as chemotherapy aids, and the first recognized class was in 1968. And more recently, there's been discussion of expansion into American Indians in the lower states, and there are different places internationally that have implemented similar programs to help their rural and underserved areas. ANTHC is the only statewide training center. We take students from all over the state. We have distance learning, which has increased access to seats available and getting more students through. And we've more recently started regional training, which allows the students to do training in their home communities and work with the providers and the people that they see every day, and it increases local awareness within the community on the role of the health aid. The CHAB program continues to be a priority for ANTHC. They are the first provider to see these patients. They provide, emergency, acute, chronic, preventative care. They know their patients, and they are increasing access to care for the people.
Yeah, I'm proud of what ANTHC has accomplished as a team. We're all here for the same thing.
We're always looking for opportunity to better our health care.
To work on behalf of our people and make sure we have better health care throughout the system, and we're making progress.
I'm sure in time we will reach all our goals.
We need and deserve the best care possible, and we are getting there. ANTHC is getting there.